Hi everyone and welcome back to the channel. If you or a loved one is living with psoriasis, psoriatic arthritis, or axial spondyloarthritis, you've probably heard about a treatment called Taltz. Today we're going to break down what it is, how it works, who it helps, and what you should know before starting it. This video is brought to you by Dr. Rezaian, a specialist in arthritis and autoimmune diseases. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Autoimmune diseases like plaque psoriasis, psoriatic arthritis, and axial spondyloarthritis can disrupt every part of a person's life, from the way they move to how they feel in their own skin. But modern medicine continues to offer new solutions. One of the most promising treatments in recent years is Taltz, also known by its generic name, ixekizumab. This medication is part of a class of biologic therapies that target specific pathways in the immune system to control inflammation and relieve symptoms. Taltz is not a traditional pill. It's a monoclonal antibody, meaning it's made from living cells and designed to interact precisely with your immune system. Specifically, it targets interleukin-17A, IL-17A, a powerful protein that drives inflammation in many autoimmune conditions. When IL-17A is overactive, it can lead to scaly skin plaques, swollen and painful joints, and stiffness in the spine or pelvis. Taltz works by blocking IL-17A, helping to interrupt this cycle of inflammation and give patients a chance to feel like themselves again. This medication is FDA approved for several important conditions: moderate to severe plaque psoriasis in adults and children over 6 years old, psoriatic arthritis, ankylosing spondylitis, and non-radiographic axial spondyloarthritis. These are all diseases that stem from immune system overactivity, and many of them overlap in symptoms and triggers. Whether the inflammation shows up on your skin, in your joints, or deep in your spine, Taltz is designed to provide targeted relief. So how well does it work? In clinical trials, the results were striking. For people with plaque psoriasis, over 80% of patients achieved a PASI 75 score, meaning a 75% improvement in skin symptoms within just 12 weeks. Nearly half of them reached PASI 100, which means their skin completely cleared. These results weren't just impressive, they were among the best seen with any biologic therapy on the market. For people with psoriatic arthritis, Taltz significantly improved pain, joint swelling, and physical function. It also helped with enthesitis, inflammation where tendons insert into bones, and dactylitis, inflammation of an entire finger or toe, also called sausage digit. And in axial conditions like ankylosing spondylitis or non-radiographic axial spondyloarthritis, studies showed Taltz reduced back pain, improved stiffness, and lowered inflammation seen on MRI scans. These benefits were seen both in patients new to biologics and in those who had already tried and failed tumor necrosis factor, TNF inhibitors. Taltz is taken as a subcutaneous injection, meaning it's injected under the skin, typically in the abdomen or thigh. For psoriasis, the dosing begins with 160 milligrams at week 0, followed by 80 milligrams every 2 weeks through week 12, and then 80 milligrams every 4 weeks for maintenance. For arthritis and spinal diseases, the dosing starts with 160 milligrams and continues with 80 milligrams every 4 weeks. The injections are usually given at home using an auto-injector pen, and most patients find the process manageable after a short period of training. No medication is free from side effects, and Taltz is no exception. The most common side effects include injection site reactions, upper respiratory infections, and nausea. Because IL-17 plays a role in defending against fungal infections, patients using Taltz can occasionally develop candida infections, such as oral thrush or yeast infections in the groin area. These are usually mild and treatable. One important note: Taltz may worsen symptoms of inflammatory bowel disease, like Crohn's disease or ulcerative colitis, so it's not generally recommended for patients with those conditions. In terms of monitoring, patients are generally screened for tuberculosis before starting therapy. Your doctor may also check your liver function, complete blood count, and any history of fungal infections or gastrointestinal symptoms, depending on your overall health profile. Once treatment begins, Most patients don't require frequent lab monitoring unless they develop new symptoms or complications. How does Taltz compare to other biologics? That depends on the individual. For patients needing fast and dramatic skin clearance, Taltz often outperforms older therapies like adalimumab, Humira. Compared to other IL-17 blockers like ixekizumab, Cosentyx, Taltz has a similar mechanism of action but different dosing and slightly different clinical profiles. It may not be appropriate for those with active inflammatory bowel disease, but for people struggling with skin plaques, joint pain, spinal stiffness, and fatigue, it's often an excellent option, especially when other medications have failed. In summary, Taltz is a powerful, targeted treatment for autoimmune diseases that affect the skin, joints, and spine. It works quickly, delivers high rates of symptom improvement, and can help people get back to living their lives. But it's not a one-size-fits-all solution. Every patient's body, lifestyle, and goals are different, so it's important to discuss Taltz in depth with a rheumatologist or dermatologist who understands your full medical picture. Whether you're new to biologics or searching for a treatment after others have failed, understanding the science behind Taltz can help you make confident, informed decisions. And for many patients, it opens the door to better health, greater mobility, and clearer skin. If you found this helpful, please give this video a thumbs up, subscribe, and share it with someone who might be considering biologic therapy. Thanks for watching. We help you take charge of your autoimmune health, one video at a time. See you next time.